I'm Graham Loy. I'm the Chief Executive for Western Sydney Local Health District. Welcome to our discussion on International Women's Day. I'd just like to start by acknowledging the traditional owners of the lands on which we meet. We're on the lands of the Barramatical people of the Darug Nation and pay our respects to elders past, present and emerging, and everyone who's with us in the room today. It's going to be a really good discussion today, talking about the role of women in Western Sydney and the strength of the women that we have that represent who we are and what we do and the services that we provide. It really is an amazing group, and if I think about some of the stats around women in Western Sydney, it really is quite astounding. 73% of our workforce are female, 55% of our executive are women, 65% of our managers are women. We have a really strong representation, and it's really great to work with such a diverse group of people. You know, diversity in our culture is really strong, and diversity in our workforce is equally as strong. So it's really good to see that the panel is representative of the amazing people that we have working with us and the amazing women that are in the system with us today. The panellists are a really strong group, so I really want to thank Dipti, Belinda, Jacqueline and Bernadette for coming out and having a conversation with us and really sharing some of their experiences over the last 12 months and what it means to be a woman in Western Sydney and as part of Western Sydney Local Health District. Really is an amazing group. I'm really keen to hear from them, so I won't spend too much time talking because you don't want to hear from me. I'd also like to welcome our facilitator, Harpreet Kelsey. Harpreet is the Director of Aboriginal Social Change Agency and of Indian heritage and born in Kenya. Harpreet has worked with underserved communities in Australia and specialises in health, wellbeing and healing. So Harpreet, thank you, welcome, and I'll hand over to you to talk to the team and have a great conversation today. Thanks very much.
Thank you, Graham, for that introduction. What a privilege it is to be here on International Women's Day with our amazing panel of women leaders here in Western Sydney. I would like to acknowledge the traditional custodians of the land that we all meet upon today, elders past, present and emerging. And start now by introducing you to the amazing panel that we have today. First, we've got Belinda Cashman. Belinda is the Manager of Aboriginal Health at Western Sydney Local Health District and a proud Wiradjuri woman. She has an excellent understanding of Aboriginal issues in both urbanised, rural and remote settings and works collaboratively with key stakeholders to improve health outcomes for Aboriginal people. We next have Dipti Zachariah. Dipti is the Multicultural Services Team Leader for Western Sydney Local Health District and brings over 20 years experience in multicultural and population health, learning and development. She leads a portfolio that includes women's health, domestic violence prevention programs, maternal health, bilingual community education program and multicultural youth programs. We now have Bernadette Wakes. Bernadette is the Western Sydney Local Health District Patient Safety Clinical Quality Manager and works in a variety of clinical specialist roles in her 17 years at Western Sydney Local Health District. Bernadette received the Chief Executive Award for Excellence in Nursing and Midwifery at the Nursing and Midwifery Awards last year. Congratulations, Bernadette. And that was for being the Operations Manager at the Westmead COVID-19 Vaccination Hub. And lastly, I'd like to welcome Jacqueline Dominish. Jacqueline is the Western Sydney Local Health District Director of Allied Health and Adjunct Associate Professor at the School of Health Sciences, Faculty of Medicine and Health at Sydney University. She's responsible for district-wide leadership and professional governance of the allied health workforce and supports the strategic and operational effectiveness of the district. What a panel we have here today. I'd also like to welcome all of you joining us virtually today. It's been wet, to say the least, and I hope you're all safe and dry at home. What excites me about today is that we're having a conversation about the issues that matter to women in healthcare, extending this conversation, celebrating, but also building on this for change. We're going to have a free-flowing discussions, so I welcome our panellists to jump in, challenge each other, agree, whatever you feel like. The past few years have brought unprecedented challenges for all communities. With fires, floods, a global pandemic, more floods that clearly indicate that we're living in a climate emergency, and now the global threat of war. We continue to see a picture of uncertainty, but it's also the strength and resilience within our communities and often the continued strength of women that carries us through the darker times in life. To begin with, I'd like to hear a little bit from our panellists today about what brought them to their career in healthcare. So I'll probably start with you, Belinda, if you wanted to talk a bit.
I started in healthcare about 20 years ago, and I started as an Aboriginal liaison officer. I actually accidentally fell into the job, to be honest. I had taken a redundancy from a Commonwealth agency and applied for a few jobs. I was a single mum, and I ended up as an ALO in a different district. I then went on to become an Aboriginal Health Education Officer. I really liked what I did. I liked supporting Aboriginal people when they came to hospital, but there's two sides to Aboriginal health, and I think there was a preventative measures and there was the hospitalisation. So I rolled into that job, and then I started a statewide position not long after that. So then I left, and then I've returned 4 years ago in a management role. So that's me.
Thank you. And Dipti?
My story is different. I started my journey with Western Sydney Local Health District. I come from a completely different field in learning and development and strategy, but just a backstory. I did sleep with my grandfather's stethoscope under my pillow, but my sister on the next bed went to med school. But being in learning and development, built those skills that could be transferred, and I'm very thankful the LHD gave me the opportunity. So I started as a bilingual community educator because of the languages I speak with the New South Wales Education Program on female genital mutilation, and went on to lead a program called Women's Health at Work that supported migrant women in vulnerable jobs, working alongside their employers to improve their health outcomes. Moved on to population health and worked at Westmead Hospital, all under the multicultural banner. And I love it because learning and health and empowering communities who need it has encouraged me, built me being a migrant myself, and having a very supportive team. So at Health, I have always been given a chance to give it a go, and have learned alongside the communities I support.
Thank you, Dipti. And Bernadette?
I'm a nurse by trade, became a nurse by accident. I think it was more a bet challenge accepted by my big brother, who didn't think that I would go through after I jokingly said I'd be a nurse. And he didn't think I'd finish it, so I finished it just to prove a point. Luckily, I'm very grateful for that moment because I think in the back end, my mother encouraged me to go and volunteer at the local nursing home, just to make sure that that was a commitment that I wanted to spend 3 years of my life with at uni. And I was really surprised, like initially with getting over dementia and the smells in that nursing home. I think I'll never forget the stories of the wisdom of the elderly, and especially I think remembering how lonely they are in that vulnerable time. So that sort of carried forward with me with studies, and I've been very committed and loyal to Western Sydney Local Health District. It is my local community. It's always been a dream to work at Westmead. Started my new grad program there and have just been nurtured and mentored really well. Had really good learning opportunities in the surgical nursing space. Was a clinical nurse specialist, and then went on to become a nurse unit manager. And then I guess as marriage and children come along, you grow and evolve as well. So I think that's what I love about healthcare. Wherever you are in your career or life, you can sort of sit back and think, oh, what do I want to do, and where do I want to grow? And there's so many opportunities, and I think that's probably why I've stayed around for 17 years, and I look forward to sort of seeing what grows in this space in the next 17, I guess. That sounds
And Jacqueline?
So I, as a teenager, loved sport, loved anatomy, used to injure myself lots playing sport, and spent a lot of time in the physios, with the physios. And originally I wanted to be a physio because I thought that would be really cool, like treating footballers and doing all that kind of stuff, like a sports physio. But then bit of a personal tragedy. A friend of mine, I was watching him play rugby league, and he basically went down to score a try and his head hit someone's knee and he became a quadriplegic instantly at the age of 16, and so that was a pretty traumatic thing to go through, but through that situation I witnessed him and his rehabilitation through the spinal unit at Royal Rehab, and started to understand the profession of occupational therapy, and realised that that was probably a better fit for me in terms of that real dedicated passion of helping people to regain independence, particularly after severe injury or illness. I had a very strong sense of, I suppose, empowerment and social justice about supporting people with disability, and was lucky enough to actually get into uni and get it done. So I was, it wasn't what I initially expected, but I love my profession, like my base profession, but it's actually enabled me to travel around the world, work in different places, and once I finished being a clinician, I wanted more. I wanted to be able to learn more and do more, to be able to influence not just district change, but change at the state level, change in policy, being able to use influence and knowledge to advocate for things that those that can't advocate for themselves can change. And so I take my role pretty seriously in this role as a member of the district exec, that I have a responsibility to serve the public, serve the staff, ensure that we're doing the right thing and keeping the community safe. So it's been a good journey for me, and hopefully it'll continue that way. So yeah.
Thank you. I'd now like to ask our panel a little bit about what you think are the issues that affect women in healthcare from the communities that you work with and represent. So Belinda, I might start with you. What are the sorts of issues you see emerging in the Aboriginal community in Western Sydney, and especially when it comes to Aboriginal women and their experience within healthcare?
Just generally? Or you're talking from a workforce perspective?
Well, either or. Yeah.
Yeah. I think, historically we know that Aboriginal people, particularly women, don't present at hospital for our healthcare needs. So we were turned away from hospital, my ancestors, to get their healthcare needs met, and when they did present, they were often dealt the blow of scenarios like the children have no shoes on their feet, snotty noses, those kind of things before their healthcare needs would get met. So the children potentially were removed, hence people stopped presenting at hospitals because of institutional racism, which has unfortunately led to many, many years of Aboriginal people's healthcare needs being, detrimentally, look at close the gap statistics. So I think for us in Western Sydney, it's about building our portfolio to make sure that we provide culturally appropriate healthcare to our local Aboriginal community and our women and their children by looking at innovative ways of how we address the healthcare needs for Aboriginal people, and one of those at the moment is the draft maternity model of care that we're looking at specifically for Aboriginal women. From Westmead, Blacktown and ourselves, we're offering different models like the antenatal clinic, then you've got the AMOS program, and then you have the Dragonfly program at Westmead that deals specifically with Aboriginal women under the maternity caseload midwifery. So I think it's by giving people choice that we're able to offer better healthcare practices that are culturally safe, and we build the cultural integrity of Western Sydney Local Health District to the community. For me, as an Aboriginal woman, I'm glad to be a part of that, because it shows all young women out there that we can do anything that we put our minds to. And we can be part of a movement that needs to be strong and empowering, not just to non-Aboriginal women, but also to our young girls.
Yeah, thank you. Dipti, when it comes to multicultural communities in Western Sydney, they're very diverse, they're large. With your experience over the years, what do you see when it comes to multicultural women in healthcare and what their needs are?
with multicultural women, just like other women, the challenges that are across the lifespan, right? And women come at different ages with different experiences and journeys, especially with women from communities such as ours in Western Sydney. There's so much of vulnerability that exists, and they bring with them brokenness, resilience and strength, but a hesitancy to engage with structured systems because of what has happened in the past. Language is a big issue, and many a time, we try to fix the gap, saying, we could have a translated information sheet, but we've also got to remember, because of what they've gone through, maybe they've never gone to school. So there's just not health literacy, but there's no literacy. And if I'm not treated as an equal or as an intelligent person, I will refuse to engage. So many a times, we assume that if it's like a short gap fix, it's going to do magic. But what has helped, as Belinda was sharing, is where each one of us strive to empower them at every moment of engagement. And they have different issues. They have chronic conditions. Fate is larger than them. They have commitments with families. They've never lived in a nuclear setup. Maybe they've grown up in refugee camps all their lives, and this is the first time they're doing life differently. And they still have to engage with health. So, the lack of confidence, the lack of being appreciated, the lack of support to draw them out. So there are a lot of issues, and not understanding preventive health. Because fate is above me, so big deal. I'll just figure it out. And just doing life, I can't read the notices on the bus. Which bus do I take? Which train do I take? I don't understand English. My accent sounds different. I look different. I smell different. I dress different. So a lot of inhibitions. But the issues around health are similar: mental health, domestic violence, parenting. I've never had parenting done to me, so I don't know how to be a good parent. So reproductive health, contraception. Like I was thinking during COVID, contraception should have been an essential and should have been dropped off at apartments and blocks. I don't know, but it's a whole lot of things. But they're precious women, and they've proved to us, especially in the last 18 months, that they're strong, intelligent, and they're equal.
Thank you, Dipti. Bernadette, from your point of view, what's unique when you look at women in healthcare in Western Sydney?
I think probably just touching in what Belinda and Dipti were saying. I think in my current portfolio for patient safety and clinical quality, I feel like when you touch on Graham sort of opening up with 65% of our workforce being women, it's also a very multicultural workforce that live within the area, and I'd love to see more of stories within that space, because within that cohort, they're often the first to graduate from uni. They're often the first to come into the country. They're very good translators. So I like to call them bridge builders. That's what I describe my generation, because I'm a first generation person that's sort of come because my parents have come from Tonga. We're very good translators, very good at reading the room, and very good at collaborating. So I'd love to see more of that workforce come into the safety and quality space, because then it would complement the work, access to care, and all the multicultural work that's being done in that space. Because we are at home the translators for Grandma and Grandpa. We are at home the ones that are trying to mimic what Grandma and Grandpa are trying to say because they're speaking in a foreign language, but you've been taught English. So we're very good at reading that space, and I'd like to see that come in, especially as we start to sort of go back to business as usual with COVID, just to sort of cultivate on that, and just get more translators from allied health, pharmacy as well, more of a MDT or multidisciplinary kind of representation of that.
Yeah, thank you, Bernadette. And Jacqueline, what do you see from your perspective?
So I think I'll probably answer it in two ways. Maybe firstly as an employee in the healthcare system, and then secondly as a let's call a middle-aged, middle-class white woman from Western Sydney, sort of some of the issues that I think affect my kind of group of people. But in terms of reflecting on my career, and particularly now being in Western Sydney, I think some of the positives for me, like I was always, my own nature was that I didn't feel like anything was out of reach. I was really determined. I was a bit of a tomboy, and perhaps working in female-dominated areas, I haven't experienced some of the biases that you might get get in other sort of industries. But what I would say, and I'd say agree with Graham, there's certainly been a significant change in the percentage of female leaders, particularly in senior executive roles in the district, and also our managers and our entire workforce. So in that respect, we're doing really well. What I would say that's a bit controversial is probably the things I've experienced more in health are when women don't support women. And I think that is something we really need to have a conversation about. I know it's controversial, but Madeleine Albright used to say there's a special place in hell for women that don't support other women. And I think sometimes that is a situation from a culture perspective within the workplace we do actually need to address, because as you guys have articulated, women are fierce, we're strong, we know how to fix problems, we're the carers for our families, and so you put that power and that goodwill together and you can achieve anything. From the perspective of myself and I suppose the group of people that tend to pay, have high levels of private health insurance, live up the kind of northern end of the district in the hills, some issues transcend all populations, including domestic violence. I know we've got one of the highest rates of domestic violence in the country in the hills area. But interestingly, just from a personal recent experience around obviously women's health is often focused on the bikini health stuff, and perhaps not so much on everything else, because we leave all that to the last minute because we're looking after our children and our husbands. And but even in that respect, I mean, I personally, recently was sort of facing down the barrel of a hysterectomy, at my age, and through a journey of having options, realised that there were other options that I could access. But the barrier to that, not just for me but for many people, wasn't necessarily goodwill of clinicians working in places like Western Sydney. It's decisions that have been made much further away from where we work. So at the federal level, about what does attract Medicare funding, around what you can get an MRI for to diagnose a condition. If you can't get that first diagnosis done because it costs you $800, then you can't even get everything else done that you need to do. So, in my case, instead of 6 weeks off work at a major operation, I had 1 week off and, 1 day in hospital, but I had to pay out of pocket for that. Whereas, I can't even imagine people that aren't in that situation, not having that option. And that stems all the way back up to the things I was talking about before, is not only what are we doing here in our backyard, but how do we shine a light on other things where there are biases, such as who's in government, what medical colleges are fighting against each other to have certain things approved, and that has a knock-on effect all the way down to the front line. So I suppose that's my perspective.
Thank you, Jacqueline. I want to stick with one of the issues you raised, which is around women supporting women. We have a very safe space here with a great panel, and I know that there's probably a lot of our viewers who are tuning in who, are interested in exploring this a little further. I'd really like to open up to the panel about maybe not your experiences, but advice that you have for all staff, but especially women who may be in situations or have been in situations where they've not been supported. It could have been bullying or harassment, it may be lateral violence, but we know these things happen across all industries, but even within health. What advice do you have for women out there who may be in a situation like that now? Who would like to kick off? Yeah.
Lovely. Okay.
Yeah. Thanks, Dipti.
I think it's very bold that we've actually brought it out outside, and the fact that we recognize it is important. But I think at an individual level and as a collective, to know that you can reach out for help and you don't have to be quiet. And also, each of us accountable when we see it. We spoke a lot about people, sitting on the fence or just watching on. It's important for these people to jump in and call it out. Many times it doesn't happen because you're like, I've done it, it's happened to me, so just suck it up. So I think as a collective for us to call it out, and as an individual to appreciate and understand it's worth the risk to say, that I've been wronged, and I need to find a solution. And within our circles and area of influence, especially if I can use the word women of colour, there's so much more that one has to do to prove oneself, because there's a loss of number of years, there's a new start, etc. And sometimes there's a tendency to just accept, because, oh my goodness, I better be grateful that I even have got a chance to kind of prove myself or do something worthwhile. So I think we should rise above that. And personally, I think I've stood up and called out things, and I've had a very selective, supportive manager and team who've allowed me to do so. And I think those of us who are in places of influence should do it, and those of us who are affected should know that we've got your back. So give it a go. We'll see what happens after.
Thanks, Dipti. Jacqueline?
I'd probably echo what Dipti said. I think from two perspectives, as a manager and a leader, I think we have a responsibility to make sure we're modelling the behaviour we expect, but we're also ensuring that the people we recruit and come to work for us have the same values, and if they don't demonstrate that there are consequences for that. And I think that staff should and should have faith in us as leaders that we will tackle those things. And I agree. I think people should, take a bit of a risk and call things out and sort of puff your chest out a bit and know who you are and own your own values and your integrity and what you know is right and wrong and what you know you're good at and what contribution you're making if it's to this organisation. Certainly that's how I've tried to act in those situations, and I think also seeking out who are the people that you know are decent and are valued, who you can get support and advice from. And obviously there's all the usual things in place like HR and EAP and those lines of inquiries that you can go down if you really need to. But I think it starts from a sense of owning your behaviour, standing up to people and finding those allies around you that have similar values. And as managers and leaders, I challenge all of our managers and leaders, but particularly our female managers and leaders. How is it that you're behaving towards your colleagues? How is it that you're behaving towards the people that you manage? And needing to recognise women do have additional, capability, I reckon, to take on millions of things, but they also have a lot of pressures in their lives. A lot of my staff are carers for elderly or disabled relatives. People have children, people have other life stories that have occurred, and I think we need to be a bit kinder and kind of really see people at a human level rather than being caught up in, I think historically there's perhaps been that competitiveness and I want to win and I want to be the best and I want to be the one that's noted for everything, but it's not healthy. Like, we're all working towards the same thing. So, keep that goal in sight rather than other stuff that's better left in the schoolyard from my perspective.
Thank you.
Yeah.
Bernadette?
You can definitely touch on what's been said so far. I think more of it is mastering yourself and knowing that there are other things that are going on in your own life and sort of making sure that you've got that emotional intelligence on when you're at work. You've got a professional responsibility to role model the core values, and if you're not feeling it, then call it out and manage yourself. And if that happens, then you're probably more likely to do some reflection and go, okay, well, that didn't sit at a really nice tone in a meeting. Maybe I should have the courage to call that person up and ask if they're okay, and go down the confrontation pathway in a private manner rather than in a meeting, especially now that we're trying to sort of go back into face-to-face meetings. I think there are some behaviours that we as leaders and managers need to role model, sort of making sure that it's called out, but then it's also managed privately as well, not in a public forum.
Thank you. And Belinda?
Well, there's nothing much more that I could really build on that the other women on the panel haven't already said, other than Aboriginal women. There was a study done by UTS last year in October 2021 where they did the first kind of research for Aboriginal women in the workforce, and it was noted in there that Aboriginal women feel less supported and experience racism and culturally unsafe work practices at least 10 times higher than that of other women in the workforce, and often don't utilise the avenues that are available to them, because often they're the main carer, or it's taken a long period of time. So I think that sometimes our systems don't work, and our systems don't work because they don't necessarily understand them. And if they don't understand them, they won't access them, or they don't feel safe enough because they see, from an Aboriginal perspective and being First Nations people, we're governed by a lot of policies that aren't they're in place for everybody and not necessarily Aboriginal people. So I think for us as women that, you know, we need to take even more of that stand to pursue that a little bit more. And I think the other thing is around that is that there's not as many senior Aboriginal women in, you know, we make up less than 5%. You know, so it's an evolving thing for us.
Yeah, thank you. I'd like to move on now. We all saw the impact of the pandemic of communities in Western Sydney. I'd like to discuss if, from your perspectives, you found that women were adversely affected by COVID, not just in healthcare but beyond, and if so, how? And what changes in this shift of dynamic do we need to make going forward? So I might stay with you, Belinda. If we look at Aboriginal women and communities in Western Sydney and the impact of COVID and the pandemic, which is still very much with us, what did you see and what do you think needs to shift?
It was really interesting because I seen that question and I kind of went, I don't know if I actually thought of that in the sense of how it affected us as a community, other than we were identified as, you know, by the Prime Minister as vulnerable populations. So that put a different spin on it for us. None of my staff worked from home during the last 2 years of the pandemic. They didn't want to. They wanted to be there for the community. And, you know, Western Sydney, I'm very proud to say, was kind of a lead for a lot of us in moving forward with the Aboriginal community. We, you know, developed flyers and we were always on the go. What that meant for me personally as a mum was that I wasn't homeschooling, so my kids were homeschooling themselves. And I was always there, but I wasn't present. And it was different, so we were all learning, and I think that we all learnt together, which made it good but not so great. But it was, we were able to be there for the community if they needed us. But I suppose as a mum I kind of felt like I sacrificed some of that. I was very fortunate that my children didn't really, you know, venture outside of the house. And, you know, I even had one of my eldest sons was a total non-believer, so it was kind of, COVID doesn't exist and I don't want to get vaccinated and I don't want to do this. And then I had a set of twins who were like, oh my God, I'm not even going to the shop. So it was managing those behaviours was hard, but also the beliefs in the community of, you know, wanting, once vaccinations become available, or what was available, because it still is an evolving situation where guidelines change or systems change or people change. Governments have changed during this time. Policies have changed, and so we are the front bearer of delivering that news to communities on a regular basis. So we have to be above that and we have to be correct because they believe in us. And it's been difficult. We've seen a lot of women who have experienced domestic violence. We've seen a high birth rate. We've seen a lot of people lose their jobs. Mental health has increased. And, you know, somehow we just still roll on and we deliver the services and we're there for them. I don't know how else to really break that down.
Yeah. It's been challenging, I think, for everyone. And we'll come back to your point about like what you needed to sacrifice, because that's something I want to touch on today about being female leaders. What's that balance look like between work and home, and does that exist, you know? But let's stay with this for a minute. So Dipti, when it comes to multicultural communities and the impact of COVID, you know, what do you see needs to be done differently?
Yeah, no, just adding to what Belinda said, it did affect, and COVID was an equalizer. If I look at the audience and said, who here was not affected by COVID? I don't think we're going to have a single person raise their hand. And with women, I'd like to use the word intrapreneurship, you know, whether it was women at health or women at the grassroots. Leaders emerged. And I know we have our corporate comms team backing this event today. You know, they have seen people on the ground who gave their voices, who told us what needed to be done, and a lot of them were women. And the reality is, like Belinda said, imagine a woman who's never gone to school having to homeschool 5 kids in a 2-bedroom apartment. That was the reality. And she actually had maybe casual work that never came in. Women who had to be stuck at home with a perpetrator, but she still loves him and loves her kids. There were communities who lost people during the pandemic, and there was no bereavement training, but women rose. And these same women were the women who came to work too, because like Belinda said, none of her team stayed home. So there was an uprising of sorts, and the pandemic brought to the surface issues and gaps that already existed. So I think in that way it was good, because people are like, oh my goodness, is it true? Yes, it is. It's always been there. And this kind of like multiplied it and doubled it. So women really struggled. And I know our team, like we had to do things that were different, like actually create special teaching aids. We're multicultural health. We're not. Like, so I spoke about intrapreneurship because people had to do it. We had to do production like Carlos, have videos, get inputs from people like Jara saying, he's like, don't do this, don't do that, but women did it. We did telehealth, a cousin of telehealth, we ran education sessions using WhatsApp, where women gave information to their communities. So there were a lot of things that women took on. You know, there are problems, but we came up with solutions. And I think going forward, we need to keep that traction. We need to build on what we've already built. We need to celebrate and enhance things that have been put in place, whether it's in telehealth, whether it's, you know, closing the digital gap, whether it's closing the gap from a social, economic perspective, and making us equal, both from a workforce perspective and we experience things like, you know, doing work differently, so maybe designing jobs differently. I know we have HR teams here, I don't know, but I think it's a good time to strike, and we'll be supported.
Wonderful. Bernadette?
I'm not sure if I can comment from the community. I think the past 8 to 9 months, especially at the peak of the COVID-19 pandemic, I saw like pretty sort of pushed on, like leaders rose, like people that wouldn't normally step up, had a can-do approach, and when the pressure really was on to deliver for the community, and I'm speaking from the context of the vaccination program, yeah, there were a lot of quiet people that you would have just said hello to in the corridor that stepped up. There are a lot of leadership styles that I got exposed to, and I now know what it looks like. From, you know, the pharmacy space, the allied health space, you know, my mentor, my map for leadership is nursing based, but it completely opened it up and gave a broader view of what leadership looks like for females. And I guess from now that I'm in a patient safety portfolio, I'm more curious as to knowing that 65% of the workforce were female, and they were the doers behind the healthcare frontline, and they were the doers at home doing homeschool and looking after elderly people. You can't help but be curious about what the impact was and what we can do to learn from that and make sure that we look after each other, to make sure that those heroes are sort of highlighted. So it's really nice to sort of see it through corporate comms. But then also, how can we extend it further? It's also an opportunity that I feel our children and family probably never were privy to. So if you had to work from home or you had to isolate, that's probably the only time once in a century that you would be able to see your partner with their work hat on. Or your children would actually see what you do, and more questions come out in the dinner table about what you do, and I feel they're more curious about, can I come to work with you? So I feel like we should probably expand that more now that we're going back to business as usual, and I'd love to see bring your daughter to work day, because that's the way to sort of hone in and turn it into an advantage. Yes, it was tough. Yes, it was agile, and yes, it was probably hard on our well-being, but I think it's really good to sort of make a gem out of it and let them see where you work, and let them see what you were doing that whole time that you were busy and you probably didn't even get to kiss them goodnight. They're really curious, so I think it'd be really good to sort of grow in that space. I'd also like to see more of the healthcare workers' children come together and run a homework club or something like that, so that, maybe, you never know, you might get the next leaders to come out of that, and we're probably the well-versed to tell them what healthcare is really like. And if they've had a few tours around, you never know what careers might come out of that space, because it is crazy hours, but you can turn it into a gem.
Start young. Yeah.
I'll just add something briefly that we haven't probably touched on, is the impact of people with disability, but also that knock-on effect to women. So certainly we saw, families, but particularly mothers, trying to look after children or older children with severe behavioural issues that couldn't go to their normal daycare or day routines because they were all shut. People that were disability support workers couldn't come into homes to then provide that usual respite and relief. So, and then you add that on top of, perhaps you're a single mum and you might be from an Aboriginal community and you might, be on a pension or something like that. Like pretty tough kind of situation. But I think probably the strength, though, of women to be able to get through those situations and to kind of come out the other side, I can't underestimate some of the things that people would have had to have done. But, again, that knock-on effect to women with disability, and no doubt, they have significant issues with accessing healthcare at the best of times, but the last 2 years has been an extended period where they probably haven't had access to GPs and, those normal health checks that they would usually get. So, yeah.
Yeah. So to continue, I guess, on this similar sort of train of thought in sharing, I know that a lot of women generally, wear a lot of different hats and have a lot of different responsibilities. So you've got your work and work life and work responsibilities, home life, home responsibilities. You may be a partner, a mother, a sister, a daughter. We were all different things. Do you think that, the pot at the end of a rainbow of, complete work-life balance exists? Do you think it's possible for it to exist, or what does it look like for you? I know, Belinda, you touched on the sacrifices that you've made personally as a mother. What does that look like for each of you? And what advice would you have for, our viewers who may be young women who are trying to battle and are a bit conflicted about who suffers or what suffers, or is there a magic formula? Yeah, you can kick off, Jacqueline.
I think it's something you have to constantly work at and be very aware of, and it's that constant balance between, putting your own oxygen mask on first and trying to then save everybody else, and you're not always perfect at it. I think I'm a mother, I've got a husband, and I've got 2 young children, one who's just started kindy and one who's in year 4, and I can honestly say that I would never have got to where I am professionally, because work is very much part of me. I'm very driven. I love my job. I love doing what I do. but I wouldn't have got here without support of my husband. And although he drives me mental, like, don't get me wrong, I have to recognise that, I mean, the thing that was great in the last couple of years is that he did actually recognise how significant my role was, and that it was actually my job and critical to step up and do what I needed to do. And if I was on the phone at midnight, that's just the way it was. And so he was able to step in and kind of, he calls himself the primary carer now, and so he was doing the homeschooling and all of that kind of stuff while still trying to get his job. Like, he works somewhere that was manufacturing ventilators and things, so he was still having to do all of that. But I think for me it's firstly starting with myself. So what is it that I need to do to make sure I can function? And so it's simple things like sleep, eat properly, try and exercise, have a massage once a month, like very practical things that you can do to keep your tank going. And then obviously you then have to balance those boundaries around when are you checking your emails, like putting those sort of boundaries in place. But also I think just a word of advice for young women, don't ever do your husband's laundry, okay? So I've never done my husband's laundry. If he has no clean clothes, it's not my problem. We do divide all the other housework, but that's certainly one issue I don't have to worry about. So anyway, and my kids want me to quit my job though and work in the school canteen, so we'll see.
Nice boundary setting there. Bernadette.
I don't think work-life balance exists. I think it's a myth, and you're going to go down a very lonely barrel if you think it exists. I like to think of work and life, it's like seasons, like it's only temporary, and yes, sometimes work will take 90% of your time, just as long as you're really clear in understanding and being kind to yourself, saying this is just a temporary part of the year or what's happening, and that just happens to take priority for right now, but it's not going to be like that constantly throughout the year. I think the hardest challenge that I'm finding so far is getting used to operating at that level, and then when it's actually not busy, finding things to do, when really that's when I should be putting clear boundaries and do stuff that, well, my kids are in primary school, they call it bucket fillers, so things that actually fill my cup up to make sure that I can give more to others. For me, when it's peak periods where work is taking over and there's lots of competing demands, I try to stick in a school pickup every now and then, because that's my why and I need to see it visually, and then it gives me another burst of energy to get through that intense week. Another thing is sort of touching on my partner as well. I'm married, and for some reason in my head I thought I had to do everything. So I've learned the hard way after child number 3 that you actually need to communicate with that person you said you were going to do life with, and 3 times a week go through the schedule as it changes and conquer and divide. You don't actually have to clean everything. The kids don't have to be clean. Just as long as they're breathing and they're eating and that you guys are present. A big thing about making sure the phone's turned off as soon as you are at home, which I think is probably another challenge coming out of working remotely, because I think that line is very blurred. I haven't figured out that yet, but I'm hoping I'll draw on some wisdom with these women. But I don't think it exists.
Dipti.
Yeah, like I've got teen boys, so well, I'm breathing better. But I think, like, I'd agree that each of us has a purpose and different drivers. So you've got to decide what is pushing you at what stage in your life. But going back to what Jackie shared, it's important that you figure out those boundaries and you take care of yourself, and you have a good support system. So if you're going to do 90% at some stage in your life, you better have a super support system of good friends, both at work and outside. Sometimes we're kind of segregated, because you've got to love what you do, you've got to love the people. I can use the word love, right? Love what you do and love the people around you, so it's important. And I also think what the pandemic has taught us, where personal and professional kind of blurred and merged and blurred and merged, but also it's to understand it's the outcome that's important. It's not the number of hours. So maybe I could do, like, as super mums, as women, as girls, as young people, I could do something in 5 hours, which people assume take 10 hours. So you've got 5 hours back to yourself and do something interesting and purposeful, and don't feel guilty about it. And don't try to do something because you want to be perceived as a hard worker. So it's important to define what your purpose and be intentional of how you're going to execute it. So you've got to love yourself, try and love your work, love what the final outcome is, and enjoy the journey, because every season, as you said, Bernadette, is different. And equip your kids, especially with migrant communities. I tell them, you've got to move from caretaker and cop to be a consultant. That's where I am now, where the kids do their stuff. If they're stuck, they consult.
Very nice.
It's a hard act to follow. I think for me, women, I'm a single mum, and I have been pretty much for 26 years. My eldest is 26, and I have 4 children. And I bought a house by myself, and for me, I've been the one. So for me, we're like the puzzle. You know, we are the mum, we are the worker, we are the carer, we are the wife, we are the daughter, we are the sister, and somewhere in there, in your teenage years, there was you. You know, your 20s, there was still you. And I think the other thing is that I decided what I needed to be for my kids. And that drives me. It also, my community drives me, our women drive me. I've met many women across my lifetime, in my career, in the public sector and outside in the community. There's non-Aboriginal and there's women that just inspire me, and I learn all the time. Is there a work-life balance? I think there is, but you have to be pretty hard on yourself. And I go back to my first job when I was 19, and the lady said to me, Kay, her name was, she said, you actually need to have really clear professional boundaries about where you are, where you're going to go, and what you're going to do in life, because otherwise you will burn out, and if you burn out, you're no good to anybody. So from a very young age, that was instilled, and I feel very blessed that I've been able to, I don't know, have filters throughout my whole life where I've been able to learn from really strong women who have come before me in order for, you know, some of the women that are out there today. So no matter what your job is, whether you're a cleaner, whether you're an admin person, whether you, you know, are a nurse or in OT, whatever it is, you need to decide what your work-life balance is for you in order to fit you. And I agree with Dipti that the outcome is the important stuff here.
Yeah, thank you. I have to say that I'm just completely blown away by all 4 of you. You know, you're powerhouses within yourself, like every woman is. So, yeah, thank you for sharing so candidly. I want to move to a more controversial little question and ask you all today if you think that the pay gap exists, and if so, how should it be addressed? So, Jacqueline, you've got the mic.
Yeah, I've got the mic. So, I don't think it does in our system because we're highly regulated by awards and things, and I think that's a great thing. I do think it exists. I do think it exists elsewhere though, but I haven't had to experience that myself in my career. But that's just my quick snapshot.
I think I agree with Jacqueline. I don't think it exists in the healthcare systems because we've got pretty clear awards. What I do think needs to happen more for women is a review of their CV annually, and according to their award, whether it lines up towards a professional development goal to get to the next band. I think that discussion needs to get a bit more normalised for women. I know for me personally, I don't feel comfortable with bringing that up, but I guess I constantly review, and this is on the back of an uncle who's business-minded, sort of encouraging me to do that, to make sure that when I start my professional development plans with my manager, it's usually about what is it that I can do to help you with your priorities, and at the end of the year it should be outcome based, and then have that discussion about getting to the next pay grade. So I feel like that's something that probably needs to be role modelled a bit more. I'd like to ideally see that as something that can sort of be, from a leadership perspective, a masterclass around that, to build confidence around interviewing skills, CV review, negotiating pay. I think they're skills that I think women need to know what looks like a bit more, because I feel like there are probably a lot of people within their award that are probably overqualified and overperforming, and it doesn't hurt to have that conversation.
Yeah, I'll pick on Bernadette's having conversations. I'm flying the flag for vulnerable women and women from migrant, refugee and asylum seeker backgrounds, like where I don't even have the skill to negotiate, so I don't even know if it's fair. And how do you equip and build a skill, like, you know, when Jackie was sharing, like there's enough sunshine for all. So if I have somebody joining my team and I think it's unfair, it fits within the award, etc. But how do I recognize this person who's lost 4 or 5 years? How do I recognize overseas qualifications? How can I be fair? And how can I mirror that fairness so that this woman walks out and reflects it outside and is like, you know what, I was taken seriously. So I think building those skills, and as leaders taking it upon ourselves, giving it a fight. Because we're so, what are you afraid of? There's enough sunshine, right? And sometimes people on the other side don't even know. They're like, oh my goodness, really? We didn't, this has been in the system for 25, 30 years, and this is how we do life in a bureaucracy. So I think we should question, and we should teach people to question and how to question, and not feel battered. And we don't want people hopping and changing jobs. We want good people, we want to retain them, we want to develop them. We want them to know what we can give them too, and not just because I don't want to be at the mercy. So but build those skills which will help, because that's what I keep saying for women from these kind of backgrounds. Every moment is a teaching moment, is a give and take, and they will learn and they will give back.
Just briefly, I did a little bit of research, and yes, the gender pay there is a lot of inequity. I think it's at 4.1% according to last year, and which equates to about $3,500 between men and women. And men are more likely to succeed in roles at $165,000 and over compared to women, and women are less likely to ask for a pay increase within their scale and be successful in it where men are. So yes, the gender, there is inequity still with gender bias in senior executive roles, and us women, we're coming for you.
Yes, we are. I can hear that loud and clear, to be bold, to ask, and not to be fearful, to give it a go. Now, our time is starting to wrap up quickly, so I want to do a really quick zip around before we have to close. And I'd like to finish by asking you all if you can be very succinct and share how you take care of your own social and emotional well-being, and what your vision for women in Western Sydney is when it comes to healthcare. That's a challenge for you. Belinda.
Well, I have just got my white shirt as a referee basketball, much to my girls' disgust, because now I'm going to learn how to referee their sport, so nobody's happy about that. Their words to me were, you are 50. And I'm like, yes, so. So I think it's what Jackie said before, it's taking a bit of time out and putting your oxygen mask back on. And I'm at a point in my life now where I can do that a little bit. And, you know, we want to make Western Sydney a great place for not just Aboriginal women, but the Aboriginal community in using our services as well.
Thanks, Belinda. Dipti.
Thanks, Belinda. Like, she spoke about sport. I did coach my youngest son's soccer. Didn't know how to play soccer, but I just got fooled. Anyway, but doing things that are different and that are fulfilling, and not feeling guilty, taking time off has helped me. What I've also done is, like I said, having a system, whether it's a church or whether it's a community family or organization where you don't have to be the decision maker and thinker, you just soak in and take stuff. For multicultural communities, especially women, it's just so important. I like this quote. I love the love quotes. It's from my favorite illustrator, where a little boy asks a horse, "Horsey, where does your strength come from?" And the horse replies and says, "From knowing I'm loved." And when you love, you're fair, you give people a chance, you give a go, you focus on equity, not just being equal. So I think we've started on the right footing and we should not stop. And women are equal, vulnerable communities are equal, and we've got to put it into action.
Thank you. Bernadette.
I think, well, I find balance by making sure that I try to exercise 3 times a week. I don't know if I hit that target. I'm still trying. And then I guess on my ADOs, I make sure that I go to the beach and watch the sunrise so I can reflect on the month that's just passed. And that's probably just linked to my culture. Faith is a really integral part of us. And so I like to put it back to nature and soak in and breathe in all the good stuff and let go of anything that's happened in that month so that you can go back recharged again. And I like it because I make it a point to go before the kids get hungry and they love being out there, so it's really relaxing. The vision for the future for Western Sydney, I guess I'd just like to see more things that sort of bring the women together. Great things happen, great innovation, great ideas happen when women talk, so I'd like to sort of see a well-rounded sort of communal thing that brings us all together outside of our schedules.
And Jackie, 1 minute.
1 minute, okay, quick. So for me, I get my balance by, I love cooking. It's like my happy place in my beautiful new kitchen, where I love to have like 4 or 5 pots on the stove. I might have a glass of wine depending on what's going on, like on a Sunday. But I agree with the nature thing. Like I love Freshwater Beach. It's like my natural spiritual home because I spent a lot of time there as a kid. And I generally go on my own if I'm on an ADO or something like that, just to kind of soak up the waves and listen to the noise and the sand. And I also have a paddleboard now, so I'm trying to get out on that a little bit more on some flat water. So I suppose that's the balance part, just finding the things that I really enjoy that give me peace, even if it's just for short periods of time. And the other thing I do love is that my little girl comes in the morning and gives me a cuddle, and rather than just jumping up straight out of bed now, I go, do you know what, I can stay here for 10 minutes, it's all right, the world's not going to end. And last but not least, I think for Western Sydney, I'd like to see the women that are in positions of privilege or who do have the haves, make sure that you're standing up for the ones that have the have-nots, and that together we can actually achieve a lot of great things, and we don't need to get hung up on rubbish. There is enough sunshine for everyone and we can do good things. So.
Wow, so many gems. I'd love to thank you all for sharing so genuinely and openly and generously with your time. You are all bridge builders, clearly, and Western Sydney is lucky to have you all. I'd also like to thank Western Sydney Local Health District for having the courage to create this safe space and put on this virtual event to have some open truth-telling and nuggets of advice for all staff out there. And I wish you all happy Women's Day. Thank you.